I'm Ramin. I'm a PhD candidate in rehabilitation sciences at the University of Ottawa. And today I'm going to talk about my PhD research project, which focuses on the experience of residential instability among individuals with traumatic brain injury. As you all know, homelessness is one of the most critical social problems in Canada. According to reports, over 1 in 10 Canadians reported that they have experienced homelessness or marginal housed conditions in their life. Individuals with lived experience of homelessness might experience different social, mental, or physical health conditions. One of the under-recognized public health problems in the health trajectories of these individuals is traumatic brain injury, or TBI. As you know, TBI is defined as a physical damage to the brain due to an external force, which results in temporary or constant disruption in the brain's normal function. It is one of the leading causes of death and disability around the world, also in Canada, and more than half of trauma deaths are due to these injuries. According to reports, the prevalence of TBI among homeless population is between 2.5 to 4 times higher than the general population. And also the lifetime prevalence of moderate to severe TBI in this population is almost 10 times higher than the general population. A Canadian study showed that in 2014, more than half of homeless individuals had the experience of TBI. And it's interesting that more than 70% of them experienced their brain injury before the onset of their homelessness. In general, individuals with traumatic brain injury have higher rates of healthcare utilization compared with general population. But when it comes to homeless population, studies have shown that individuals with TBI are 1.5 times more likely to visit emergency department than those without. In other words, they are frequent emergency department users. But because of the advances in the medical technology and rehabilitation services, the survival rates following TBI has increased, and many individuals might live several years following their trauma with disability. And this is important in the young population because a significant number of traumas happen in the young people, and even mild injuries can result in adverse effects several years following their brain injury. Because of the heavy consequences that brain injury brings for the individual, their family, and their caregivers, they need long-term supports and services following their trauma. But unfortunately, most of the professional interventions are usually provided in the acute phase of the brain injury. A literature review, a systematic review of studies that were conducted in different countries, such as United States, European country, and Canada, was about the unmet needs and gaps in services provided for patients with neurologic conditions. And interestingly, a significant number of those studies were about patients with TBI. And the common themes and the common unmet needs that obtained from those studies were inappropriate healthcare, community and social services provided to these patients. Unfortunately, because of the symptoms resulting from TBI, such as cognitive disorders, mental and physical health conditions, it makes it challenging for these individuals to maintain their stable housing. And that's why many scholars consider TBI as one of the risk factors of homelessness. To better support these individuals, providing housing services in addition to other supports that target their needs is necessary. And one of the successful programs in this area that has been implemented in many countries, including Canada, is Housing First. That, as you know, this program provides permanent housing services to the individuals no matter of their conditions, and also provide some other mental health support to them. And this program has resulted in many positive outcomes, such as improved housing stability, improved health conditions, and also quality of life. But when it comes to patients with TBI who access these services, studies show that they showed poorer results, and also they experience poorer health conditions when they access these services. And the possible reasons for these results were they might had a distinct pattern of healthcare utilization. They needed several readmissions to emergency departments. Also, they needed regular contacts with their family physician. So these results highlight the gap that to better support these individuals, coordinated healthcare and social services should be provided for them. And also, these highlight the fact that there is a knowledge gap between what is considered as a proper housing services for patients by patients with TBI and what is actually right now is providing to them. Different studies showed that there are some barriers to providing optimal services for people with TBI who are experiencing homelessness or vulnerable house conditions. These barriers were limited evidence behind the interventions that are aiming at supporting individuals with TBI who are experiencing homelessness, having multiple concurrent medical conditions among these individuals, and also limited knowledge about TBI among professionals in the housing sectors. In general, studies have shown that to provide a comprehensive array of services to patients with chronic conditions, a coordinated approach should be adopted by related systems. But unfortunately, because of the current organization of systems, aligning factors such as mandates, budgets, and information sharing is challenging. And the unwanted result of this would be disjointed healthcare and social services provided to patients with TBI. As you know, Canada operates under a universal healthcare system, but studies have shown that many hospitals in Canada experience or have limited resources and they are overpopulated. For example, one study showed, the standard of occupancy rate in hospitals is 85%, but one study showed that in the summer of 2017, more than hospitals in Ontario had the occupancy rate of more than 100%. And sometimes this number was close to 140%. So these limited resources and this occupancy rate prevent hospitals to provide proper discharge plan for their patients. In general, discharge plans aim to support their patients to have the transitions from hospital to a proper place of discharge. This plan aims to decrease their length of stay in hospital, decrease the number of readmissions following their discharge, and also support them through the community reintegration process. But as I mentioned, because of these limited resources and this occupancy rate, hospitals cannot provide proper continuum of care for their patients. On the other hand, different studies have shown that to better support a patient with TBI along the continuum of care, there should be continuous communication between various healthcare and social sectors. But one study showed that there are some interrelated challenges and barriers for having this communication or this coordination. These barriers were lack of communication between these two sectors, privacy concerns around the sharing of confidential information, and also finally, system pressures. Despite of multiple successful interventions that have been provided for patients with traumatic brain injury, these individuals are experiencing different system pressures. You're familiar with the lack of social and affordable housing, long wait lists, and also the increased rate of market. Then add the challenges and symptoms from TBI to these pressures. So it makes it really challenging for them to maintain their stable housing. And this highlights the fact that providing housing services in itself is not sufficient for these individuals to maintain their stable housing. And as I mentioned, there should be a coordinated approach adopted by healthcare and social sectors to provide a better support for these individuals. To sum up my presentation, according to the chronological relation between experiencing traumatic brain injury, having multiple interactions with healthcare and social systems, and finally experiencing homelessness, I decided to design my PhD research project around this issue and understand how do multiple interactions with healthcare and social systems following traumatic brain injury influence the experience of residential instability. To answer this research question, I designed 3 research projects. The first one is a scoping review of literature that I aim to understand how does TBI influence the experience of individuals who are homeless or marginally housed. On the other hand, I'm interested to understand what challenges does TBI add to the life of individuals who are experiencing homelessness. Some of them are well recognized and some of them are not. In the second stage, which is a narrative inquiry study, I will conduct interviews with a few patients with traumatic brain injury who had the experience of marginally housed conditions to investigate their experience of interactions with system, with healthcare and social system, and understand how these interactions influenced their experience of homelessness or marginally housed conditions. And finally, in the third stage, which is a qualitative case study, I will choose an organization that provides community-based rehabilitation services to patients with TBI. And I will conduct interviews with the staff of that organization to understand how does that organization direct their clients toward their services to help them maintain their housing and prevent their homelessness. So hopefully the result of this research will shed more light on the gaps and challenges that are experienced by these individuals. And hopefully by the next year, I will have my results ready to share with you in this event. Thank you.